Hello and welcome. I am Dr. Lara May, a clinical pharmacist specializing in functional medicine, as well as a certified yoga teacher and Reiki master. I run a truly integrative health coaching practice encompassing functional medicine lab testing, yoga and meditation, and a sprinkling of Reiki energy medicine. Join me here on Light Body Radio to break through your health plateau and come into alignment with your natural vitality. Hello and welcome to Light Body Radio. I'm your host, Dr. Lara May, and today I have with us Antonella Dewell. She is a registered dietitian and an IBS expert. She specializes in the dietary management of irritable bowel syndrome, and she is passionate about helping women with IBS find relief from uncomfortable gut symptoms, which includes bloating, excess gas, abdominal pain, and unpredictable bowel habits, and figure out which foods are triggering them so they can stop being anxious around food, eat with confidence, and live a full, vibrant life. She is also a certified natural chef and loves creating gut-loving recipes for her clients that are both nutritious and unapologetically delicious. She currently lives in Santa Cruz, California, where she runs a virtual practice counseling clients all over the United States. And when she's not working, she loves cooking delicious, healthy food, running, and listening to audiobooks while walking by the ocean. Welcome. I'm so excited to have you here and to talk about this subject today.
Thank you, Dr. Lara. Thank you for having me. I'm really grateful.
So, let's talk a little bit about where along your journey you decided to really focus on IBS and specifically the dietary management of that.
Yeah, absolutely. It's been kind of a journey, a torture road, so to speak. I've actually spent most of my career in the research field, the field of clinical research, mostly at Stanford University. I love that. I love really, asking those questions and applying the research and finding out those answers. I feel they're so important because those are ultimately what leads to, recommendations for diet, lifestyle, etc. But after many years, at some point, I felt my job had become much more administrative than I wanted to, and I sort of lost the touch with nutrition. And ultimately, I am a dietitian, and that's what I love to do. And I wanted to make more of a difference in people's lives on a one-to-one basis. So I decided to start a side practice and counseling people. But at that point, I was just seeing people for various nutrition related issues, such as, weight management or, high blood sugar, high cholesterol, et cetera, et cetera. But the more I saw people, the more it actually, came apparent how many of my clients were suffering with gut symptoms, and especially the irritable bowel syndrome. So I did a little bit of research. I dug into the subject, and I became very, very passionate about it, and decided to, I saw there really was a gap, actually, for, dietitians specialized in this area. And I decided to just go full on it, and I just started seeing people with irritable bowel syndrome. I specialize in the dietary management of irritable bowel syndrome, mostly because, well, not only this is a very pervasive condition, 10 to 15% of the population worldwide that is affected with IBS, and it's mostly women. 2 out of 3 people with IBS are women. But the symptoms are so disruptive of your life. The abdominal pain, the bloating, the irregular bowel movement, they can really, impinge on, your social life, on what you can or cannot do, whether you decide to go out to dinner with friends, or whether you want to go for that hike, or maybe instead decide to stay home because your gut symptoms are so unpredictable that you just don't feel comfortable doing those things that all of us give for granted. And what really struck me about the dietary management, which I'm sure we'll talk about a little later, of IBS, is that it can really have an impact, and it can on people's lives, and it can actually act so quickly that in a matter of a few weeks, people go from um, having the symptoms on a daily basis to having a reduction of anywhere from 75 to 100%, and feeling so much better that their life really changes. So that's why I'm so passionate about it.
Awesome, awesome. So let's start with let's go back a little bit to the basics here. What is IBS for the listeners
Yeah,
out
yeah,
there today?
very, very important question. So, irritable bowel syndrome is, I'll start with what it's not. It's
Okay.
a disease, and it's often even confused with a very similar acronym, which is IBD, which is inflammatory bowel disease, which you may know as Crohn's or colitis. So it and I say it's not a disease because when you look at the results of blood tests, or images or colonoscopies, endoscopy, they all come out negative, because there's nothing really structurally wrong with the GI tract, unlike those other diseases where there's inflammation, or the villi are compromised, and so there's not absorption anymore. But in IBS, is just a syndrome of a constellation of symptoms, like we've talked about: the pain, the bloating, the gas, and irregular bowel movements, and it's just that the gut is not functioning the way it should. In fact, it's called a disorder of a gut-brain interaction. And the fact is, the gut to the brain are constantly talking. But in the case of IBS, this talk is not happening the way it should, and messages can be misinterpreted. And it is a chronic condition, but the symptoms can be managed to the point where patients no longer meet the criteria for IBS. So there's a lot of hope there.
Okay, great, great. And so is it something that's when it's happening, is it always present, or are there like waxing and waning episodes and triggers, or that
Yeah,
sort of
yeah,
thing?
I love that you actually use that term, because it's actually called a chronic relapsing disorder. So there is a lot of waxing and waning, and the symptoms can change over time. And you can have times when there are flares that are worse, and then you have times when they can subside. But it happens in a chronic way, so people are always experiencing them, unless they find a way to management with what we'll talk about.
Hmm. So, how can it be managed? I mean, we've talked about that you are an expert in the dietary management, so I assume diet's a big piece of it.
Yes.
So let's start there.
Yeah, yeah, so it's important to think about what triggers IBS. So diet and food is, of course, a big trigger for these symptoms, as we can imagine, but it's not the only one. So stress is another huge trigger for the symptoms. So people will tell you that their diet hasn't changed a lot, and all of a sudden, like, there is this stressful event in their life. Or for some people, it can be more like the chronic stress that happens on at work or in the family, and that can also trigger symptoms and other aspects of your lifestyle as well, like whether you sleep well or not, your exercise pattern. So it's really important to address all of the symptoms. But where my passion lies, because I am a dietitian, is on the dietary piece. And here, what happens is really every person, well, let's start with this. There is no one diet that fits everybody. There's not the like one diet for IBS symptoms that will
Mhm.
suddenly make everybody feel better. It's more of a personal discovery because every person with IBS is sensitive or intolerant to certain foods, and they're not the same for everyone. I help my clients by taking them on this journey of discovery of what their trigger foods are, and this is all based on some really solid research that was done, a little bit over 10 years ago, initially by Monash University in Australia, where they discovered there's a group of foods, mostly carbohydrates, that are responsible for triggering these symptoms because they're very rapidly fermentable and osmotic, and they can draw water in the gut, and the fermentability can create excess gas and bloating and all of that cascade of symptoms. So they observed in their research studies that by eliminating these foods, people felt better. I mean, they felt really dramatically better. Now, it's important to know that these foods are actually really healthy foods. We're talking vegetables like cauliflower or asparagus, fruits like apples and peaches and mangoes, and then some beans and lentils. The lactose in high lactose dairy product. So it's not a good idea to eliminate these foods for the rest of your life. But as I said, not everybody is intolerant to all of these. So that's where the discovery pits come in. So after eliminating these foods for a short amount of time, only a few weeks, then you get to reintroduce all of these foods one by one, or there's certain groups, and so you really figure out whether it's certain vegetables or is it the lactose or there's the fructose, what which one of these carbohydrate foods are responsible for your own symptoms. So in the end, you come up with your own personalized diet that just works for you. So you may have to reduce some foods. In many cases, it's a matter of portion size, not really a white and black. Yes, you have to eliminate this for the rest of your life, and then you can always retry these foods later on, like 3 to 6 months later, because I said this, as we talked about IBS being a chronic relapsing disorder, your tolerance can also change. So if you didn't find that you could tolerate something like garlic and onions right now, it doesn't mean you won't tolerate it for the rest of your life. But like 6 months later, you could try it again and find out that maybe you can tolerate more than you did previously.
Mhm. Mhm. Yeah. I think that's really important for people to really understand, so I'm gonna repeat it, is that
Yeah, please.
is that, when we're like I love that you call it a path of discovery, because it really is, and I feel like if we approach it with that, becomes, we bring in that energy of curiosity. And so instead of expecting, like so many times in Western medicine, someone just to hand us a solution, which is usually in the form of medication, which is just
Mm,
symptom management, not a real root problem approach,
yeah,
then when we're looking at this journey of discovery, we're bringing curiosity. I feel like we're also empowering our clients, our people, to again take an active role and to be, paying attention, giving us feedback, allowing it to be a conversation
yeah.
between practitioner and client or patient. And so again, when you're on this path, it's not forever.
Mm-hmm.
Yes, you may need to eliminate dairy at the very beginning, gluten at the very beginning, soy, corn, any of these things that are inflammatory, or any of, like you said, the fermentables. And but the whole point is that you'll feel better. So also too, if like we can flip that mindset of of withholding and into, oh, like I'm going to discover what's going to help me feel better and move forward from there.
Absolutely, absolutely. And it's the way I see it is that it's basically giving people some tools that they can use.
Hmm.
And I have like a variety of tools, and diet is one of them. And it's a powerful one and it's important one because one, we have to eat every day, right? But also food is so important in so many other aspects, of the social aspect, the celebratory aspect, the enjoyment aspect. And unfortunately, what I see in a lot of patients is they just started going down on the rabbit hole of food elimination because it's understandable. I mean, your gut feels wrong and you have these gut symptoms. You start looking at your diet and you think, okay, well, I felt so bad after eating that, I'm going to just eliminate it from my diet, but that becomes a perilous slow when you're not doing it with, and a focus in mind, and you just randomly avoid foods, because then you end up eating just a handful of foods, and your diet becomes very inadequate, but also miserable and not sustainable. So rather than going, on down on this, I call it the food restriction circle of death, where you
Hmm.
start eliminating everything and seeing food as an enemy. There's actually a discovery path that's based on research and what we know it's affecting these kinds of symptoms that can allow you to actually have a much more variety in your diet, and also enjoy your food and be able to go back and eating with restaurant or eating with friends. And the fact that, for example, certain foods really trigger your symptoms, and for example, I don't know, you have an important meeting at work, or you're on vacation, you're traveling, and you don't want to be detracted and delayed, and we want to be suffering with those symptoms, then you can avoid them. But at the same time, you have the choice, and something you really enjoy eating, and you're home and you're okay, and you know that even if you do get some symptoms, you can take care of yourself and you can deal with them. You can also decide to enjoy those foods, and there's nothing wrong with that. So that's why, it is a personal decision. It's a tool that you can use to really manage your symptoms
Hmm.
and your life.
Do you encourage your clients to keep a journal when they're on this?
Mm, yeah,
And I'm thinking too, it's probably more than just about the food, because we did talk a little earlier about that gut brain connection and the gut brain axis. And so can we talk a little bit more about, stress and
yeah.
our thoughts and how that influences our gut health and maybe the waxing and waning of IBS?
Yeah. So definitely the journal is important. Especially when we come to that, discovery process where you're introducing all these foods, and you need to figure out not just which ones may be triggering your systems, but also the amount. Yeah, to expand the picture on the stress. Um, yeah, I hear that so many times from even clients who've been, successfully reintroducing a lot of foods, and now they're enjoying their diet, and then they come back to me 6 months later and they say, I haven't changed anything in my diet, but now I have another flare, and what's going on? And so I deeper, and I ask them questions about what's going on, and then I find out that, oh, this thing happened at work that completely upset them, and they've gone through, weeks of stress, and that's your clue. Diet is not the only um, reason. And another example is, people go on vacation, for example, and finally they're not under the constant stress of work, or other things that are going on at home. They can relax, and maybe they don't check their email as often, or the text messages, and suddenly they find they can tolerate a lot of foods that at home they weren't tolerating, and they're eating more, and so that again tells you that that's the stress. Because in one way we all have experienced that is the famous butterfly in the stomach, right? That's your gut and your brain talking. But in people with
Mhm.
IBS, one way I like to visualize it is that as if the gut brain axis was a big stereo system with the speakers set up to be too loud. And so instead of talking to each other, they're screaming to each other. And so what we need to do is actually tone that volume down. And, a powerful way to do that is by utilizing many stress management techniques, because as much as we all would like to, stress is part of our life, and so the goal is not to really completely avoid it, but when it's there, to know how to manage it. So I give my clients lots of ideas on how to manage stress, but ultimately it's what works for them. Again, it's this conversation, because it can be different for a lot of people. For example, you know being able to go on a walk, could be a great way to, or exercise in general. For a lot of people, it's a great way to distress, and that could work for some people, but for others, it might not. So it could be as something as simple as doing some deep breathing, not only at the moment when you feel stress because something happened to you, but even just before you start eating your meals. And the powerful action there is that deep breathing can switch our system from the sympathetic response, that fight or flight response that most of us actually operating on a day-to-day basis if we don't really feel stress, to the parasympathetic response, which is called the rest and digest response as well. So, when we switch that, a lot of things happen in our body. Our blood pressure decreases, certain hormones, the stress hormones decrease. And if we're about to eat the meal, what happens is a lot more blood flow goes to the gut, and those digestive enzymes can start working. So we really set our digestion up for success in that moment, by doing something that simple. So yes, stress management is a huge part. The one that I really, although it's not my focus, I really have integrated into my practice, and I don't want my clients to sort of brush off, because it's so important. And even if they don't feel like stress is part of their life at this moment, it can always be, in the future. So again, it's another one of those tools you have in your toolbox that allows you to manage the flares.
Yeah, and I think it's, because I feel like some of us, maybe to us, a stressful environment is so normal that we don't see it as that. And we don't realize that connection that it's having on our digestion, which then obviously directly affects the symptoms that we're experiencing. So, yeah.
Absolutely. Yeah. Our modern life, unfortunately, is set up to have this, stress is normal, just
Yeah.
busyness and not having ever stopping to take a breath or to take a moment, or even, we're eating on the run all the time, right? And that's not normal. It wasn't supposed to be that way. We're supposed to actually stop and sit at the table and take a break and enjoy a meal. So yeah.
Yes, for sure. I'm even still guilty of that, even though I know better.
We all are at some point, yeah, but just knowing that at least, it's important.
Would you say there's some like classic, quote unquote, like mistakes that people make when it comes to managing their IBS that maybe they don't realize they're doing?
Yeah, yeah. Well, one is the one I mentioned a little bit earlier, and just basically, going down on this rabbit hole of just eliminating foods at random, just or they start hearing, they talk to friends or they read on the internet, or like gluten is bad and dairy is bad, so why don't we cut this out and why don't we cut that out? And they could be unnecessarily cutting out foods that they could be enjoying, and that's and make their diet a lot less nutritious, and could, even lead to lack of, nutrition. Also avoiding all fiber, uh, people can start being afraid of fiber, and fiber is actually your friend, and is what ultimately will help you maintain good gut health, and overall health, as we're finding out more and more from the research on the microbiome lately. But so, and that's why it's also important to, work with a professional that can guide you, because not all fiber is equal. So we talked about the really rapidly fermentable fibers. Those are the ones that could be, triggering your symptoms. There's also the slowly fermentable or the non-fermentable fiber, which you could be enjoying, and could be actually helping you, for example, in maintaining more regular bowel movements. If you're either have slow motility or too fast motility, fiber is actually is your friend. But you also don't want to overdo it. So there's a lot of, nuances there. You don't want to eat a whole lot of fiber all at once. If you are not used to it, you want to increase it gradually. And the other big, thing I'd like to, mention here is also, self-diagnosing and just going on the internet and trying to find out your own, what to do on your own. It can be really tricky. Gut symptoms, again, can be very common to a lot of other, diseases and disorders. So it is always a great idea to consult with a doctor. But even in this, protocol that I was talking about, of eliminating these highly fermentable foods, if you go on the internet and read about it, you might get the idea that, oh, that's how you have to eat for the rest of your life. And I find a lot of people that have started this on their own, but then they're stuck in this elimination phase, which they don't understand. It's just the first step. And then you have to move on. There's 2 more steps to complete it, so that you don't end up on a very restrictive diet for a long time, which in the end, you might feel good at first, but in the end, that actually might lead to more intolerability.
Yeah, I want to say a little bit more about that too, in terms of our diversity of the microbiome,
Mm.
and like you said, like if someone, let's say that they've been living off of what was called the standard American diet, so fast food, lots of trans fats, processed food, not a lot of vegetables or green things. They move into, oh, I want to be healthy, so they introduce a lot of green vegetables all at once, and that, but their digestive system doesn't agree with that, because their microbiome doesn't have the little workers in there, the cascade of bacteria and fungi and even viruses, and different things that all coexist inside of our gut to help us digest food. So same could be said if you're stuck in elimination for too long. I would think that you might lose some digestive diversity there. Is that
Yeah,
true?
there's actually research that has shown that, even it just takes 3 to 4 weeks on this elimination phase, because the diversity of prebiotic fibers is drastically reduced, and prebiotic fibers are the kind of fibers that feed your gut bacteria. It's their fast food. It's what they love to eat. Then our diversity and also the number of bacteria does decrease. The good news that is that as soon as you start reintroducing, in that process of discovery, those rapidly fermentable foods, and then in your personalized diet, when you introduce those that you can tolerate without any symptoms, then the diversity can come back. So our microbiome is actually very responsive, but there is, still the caution of, not go on these long elimination diets for like months or even
Mhm.
years. I've had people call me and said, I've been on this elimination diet for like 2 years. And, I want to, rip my hair out and scream, because research has shown that the more variety we have in plant foods that we eat, the four famous 30 plants per week, the more our microbiome is diverse, and with that comes all of the health benefits, and in the example that you just gave, sure, if somebody's just eating this basically fiber-free standard American diet, when they all of a sudden decided to go, I'm eating healthy, and now I'm eating all of these vegetables and these legumes, of course their gut is going to scream, because you know their bacteria is much more diverse, their microbiome is, and some of those species that were used to digesting those fibers may have died off. So you need to start repopulating it a little bit at a time, and maybe go more gradually with your fiber intake, and until you basically train your microbiome to get working again, and then we can have this beautiful symbiotic relationships where we feed them the good food, and they make all of these good things for us.
Mhm. And then just the only other thing I was thinking about is that we haven't really talked about the differences in IBS. So there is IBS with constipation
Yeah.
and IBS where you have more diarrhea or maybe like more what people would consider an acute flare when you're sort of, attached to your toilet for a day or so. Um, so let's maybe talk about the nuances, especially for those out there with constipation, because I feel like
Yeah.
especially myself having been through that journey, there was definitely some advice that was given to me, even by healthcare practitioners that didn't understand it, which is
Yeah.
why I think it's so important if you're suffering with this to really find someone that, has some credentials or, some sort of training in this specifically so that they understand what you're going through and you don't have to suffer needlessly by, unintentional bad advice probably.
Yeah, that's really important. So it is, IBS is not just one disorder. It has some classification because it can present a little bit differently. So there is IBS, constipation predominant, and that's where you have, very few bowel movements a week, and it could be different for different people. But it's not just about the number of bowel movements, it's also about the feeling of full evacuation that's now happening. So basically, the stool is getting stuck there, and then it becomes painful, and you may have even straining, and then there is IBS diarrhea predominant, where they have the opposite problem, is that there's like the motility is too fast, and the stool are also too loose. And there's also, interestingly enough, the mixed type, it's called, because it alternates between diarrhea and constipation. So you could be constipating for days, and all of a sudden, you go, and then it's more like an explosion, and it's still not a nice regular bowel movements that we would like, with the good consistency, good evacuation, and painless. Going to the bathroom should be, a, a a good experience. But
Right, like yeah, not
yeah,
painful and feeling relief
I
afterwards.
see it. Yeah. You see
Yeah.
these Instagram, posts where people, it's like that, getting out of the door and feeling like you're ready to dance, and they make it a little bit funny. But for sure, constipation, and I see this in my client, it's really the IBS with constipation, needs to have some particular attention, because this protocol that I described works really well for the symptoms of abdominal pain, bloating, even the diarrhea. But constipation, I like to say, it's a beast to attack on its own. So there are a lot more tools in that you need to really access to address the constipation, on its own. And you could be doing it at the same time, or you could even be starting with that, and see. Many times, constipation is really at the root cause of all of the other symptoms, because think about it, if you have stool stuck in your system, that leads to excess fermentation. While it's sitting there, the bacteria continue to ferment, and that can produce more gas, and the gas can produce more bloating. And then you feel very uncomfortable if you don't go for many days. So I feel that solving the constipation, in IBS-C, it's really, really key. And so, there are a number of tools. One is diet. I mean, we all know we need to drink a lot of water. Fiber management, the right kind of fiber that can improve the consistency and the regularity. It could be some fiber supplements that can help. But if there is a motility issues, you need to actually accelerate the motility as well. And then you have to look at other things and really deep in what's causing the constipation in the first place. Because although for most people, it's really bad diet and poor hydration and maybe lack of exercise, and that can be quite easily fixed. For some people, there's some pelvic flora issue, for example. So it's not their diet is at fault, is that the musculature around the pelvic floor is just not working the way it should. So there, in addition to diet, you need the help of a physical therapist, that specializes in pelvic floor. So it is a lot of nuance, and unfortunately I see a lot of people going to their doctor, and all the doctor can gives them a prescription for Miralax and send them on their way, or sometimes even prescription medications that can help at first, but also have many side effects, or maybe help for a little while and then they stop helping, and then people don't know where to go because that's the only thing that we're given. So it's more nuanced and needs to be really understood, and you need to keep working and figuring out what really works for you. Is it more fiber? Is it a motility agent? Is it more hydration? Is it more exercise? For everybody, there is that special combination. But once you find that, as long as you're consistent with that, then that's it. Then you found the magic formula that works for you and that can keep you regular.
Yeah, I would make a small suggestion too, that maybe some gentle yoga, because yoga, number one, it's movement, it's gentle, it's stretching and strengthening, but also there's a lot of pelvic floor engagement
Yeah.
within the yoga practice. So I would just encourage, if any of this is resonating with you, or you're sounding like, oh yeah, this is me, then, and maybe you do some yoga already, but maybe bring that attention to your pelvic floor and just, making sure that you are engaging and what that feels like around your abdomen when you engage.
Yeah, it's so great that you mentioned that. I actually have a whole yoga, handout that I give to my patients with those specific poses, because I've actually done even studies with people with IBS and show that, regular yoga sessions were successfully able to reduce overall symptoms and in people with IBS. And we know that there's some specific poses that are really massaging the gut, and addressing the pelvic floor, but also, like the twisting poses, for example, they really help our gut muscles move. And when there's constipation and things are stuck there, that can be very, very powerful. Yeah. Especially if if you can't do anything else, like if you can do more rigorous exercise, that's really the place to start. To get a good walk, maybe.
Yes, getting out in nature, but for sure. So tell everyone where they can find you and work with you.
Yeah, so I do have a website. It's my name, AntonellaDewell.com, which is quite a mouthful, but I'm sure You'll write it down somewhere.
Mhm.
Yeah, that's an easy way to contact me. There, you can get on the phone with me. No strings attached. We can just talk about your situation, what your gut symptoms are, and if you're a good candidate for my protocol. And if you're not ready for that, you can download a free gift that I have on my website. It's called the 10 Steps to Beat the Bloat. It just gives those, very basic recommendations, before you go into even an elimination and reintroduction protocol like the one I described. There's some basic things that, we all tend to forget, like not eating on the run, right? Or
Mhm.
chewing our food well, or having those, regular meals. That's so important for our regularity. That can really do a lot, So that's always my starting point, and you can get that for free on my website. And I'm also on Instagram if you want to check me out there at IBS Nutritionist RD.
Awesome. Well, thank you so much. I appreciate your time and your expertise. And today, I think, has been a really good overview and has given people, I think, some things to think about and consider. So, if you're out there struggling with any of these symptoms, I really encourage you, reach out to Antonella or, find that person that, again, um, knows about IBS, has experience in it themselves and treating it so that you can get on a path to recovery quicker. And so you're not sort of, like trying things, shooting in the dark, going through unnecessary eliminations and starting to feel better faster.
Well, thank you, Lara. It was a great conversation.
Yes. All right, everybody. We will catch you in the next episode. Thanks again, Antonella.
Thank you.